season. So I hope you guys are prepared for something completely and totally different. This is no facts, nothing but pure opinion and conjecture. Only I'm just going to be talking about myself. How about that? Time. Time is, in fact, a terrifying concept. We live in the now, but now immediately becomes then. And the future then becomes now, which then subsequently becomes then. For conscious and sentient human beings who have a grasp of our own impermanence, the idea of looking down two ways, forward and backward, and not being able to see the ends of each is difficult to comprehend. There's been a lot of art, a lot of music, a lot of poetry, a lot of writing, dealing with time and how we deal with time. Some of it not very hopeful. But I have here an example of what I would consider, one of the more comforting aspects of considering time. To everything there is a season and a time to every purpose under the heaven. Now, for those of you who are familiar with the Christian Bible, you recognize this as a verse out of Ecclesiastes, which was then picked up by the anti-war activist and folk singer Pete Seeger, who made a song out of it, took a few liberties, at the end of it to get forth his anti-war message, and then extraordinarily, improbably, became a bestseller, a Billboard 100 hit in 1965 when recorded by the Byrds. So these comforting words that tell us that we have a place in the space-time continuum are then a little bit let down by the fact that we are reminded that we come and we go. A time to be born and a time to die. We know that throughout history, as we understand it, that mankind has figured out ways of grasping time and putting it into a context that is understandable. And they do that by cycles. Very early on, of course, man figured out that nature is cyclic. We have day and night. We have phases of the moon. We have the seasons. We have hurricane season. We have monsoon season. We have the dry season. We have the tides. We have many aspects of nature that are cyclical. And in addition, mankind has created its own cycles. Some of them are purely measurements. Days, weeks, months, years, minutes, seconds, milliseconds. As if somehow, if we were better and better and better at measuring this time, that somehow it would become more comprehensible. And then there are other constructed cycles of time: the calendar year, the fiscal year, the academic year, the liturgical year, the political year, football, baseball, basketball. We've created a season and a cycle for just about everything that we do in our lives. And these are a way that we measure time has improved dramatically from the Stonehenge days to some of the beautiful mechanical clocks, that were created during the Renaissance, to, now atomic clocks, which can measure time down to aspects that you and I sitting here can't even begin to comprehend. However, these cycles serve to make time something understandable, something comfortable, something that we can deal with on a day-to-day basis. All of us have figured out a way to do this, and I don't mind sharing the way that I have. Okay, so this is an illustration from an illustrated manuscript that was entitled Les Très Riches Heures du Duc de Berry. So this was a day calendar of a very rich noble, and if you guys ever get the chance to see this, it's up in the cloisters at the Metropolitan, where they have a whole collection of illustrated manuscripts. And these were created in the Middle Ages. This is probably from somewhere in the 13th century. And you can see here that there is a peasant, a serf, sowing his seed in his field because it is the season to do that. And he's doing that with the expectation that these seeds will take root and grow, and he will have food for the winter. He will have wheat or whatever this is to give to the noble who probably owns him and owns that land. And time will go on. I suppose it's just seeing somebody do something this mundane and something that is mandated by season that I feel a connection with it, even over 800 years. This serf found his place in the space-time continuum, and I will too. We probably worried about much of the same things, although probably not stuff like, am I gaining weight, So this is the way that generally the cycle and the cycles of life are depicted. So there's a fairly symmetrical circle. You can throw in there whatever you want to. Day, night, spring, summer, fall, winter, preseason, season, playoffs, postseason, whatever it is that you want to put in there, it can fit into this nice, comfortable circle. But the fact is that we are not living Groundhog Day. We don't wake up every morning hearing Sonny and Cher singing, I Got You, Babe. Instead, this is a more accurate depiction that even if we consider life cyclical, that this is how it happens. So you start here, and then with the next cycle, it looks pretty similar, but it doesn't start in exactly the same place, nor does this one or this one. And over a period of 5, 10, 20, 30 years, you're here, and then you look back and you say, wow, it really is different. Things have evolved. The cycle may be the same, but it's not exactly the same. However, the changes that have occurred have been so imperceptible that we have managed to incorporate it into our lives, and we are comfortable with it. It doesn't bother us. Yes, certainly at my age, I can look back and say, yeah, man, I can remember, yes, I graduated from medical school in 1978, and things were really different then. My medicine rotation was 12 weeks, and we didn't have a separate this, that, and the other. And it's not until something like this happens where we recognize a huge difference. But the cycle doesn't look the same at all. And it is so disruptive that it forces us to think that maybe we have been lulled into a false sense of time security. When something like this happens, we move from an evolution to a revolution. I think exemplified very well by this poem by T.S. Eliot, The Second Coming. which was published in 1919. Turning and turning in the widening gyre, the falcon cannot hear the falconer. Things fall apart. The center cannot hold. Mere anarchy is loosed upon the world. The blood-timmed tide is loosed, and everywhere the ceremony of innocence is drowned. The best lack all conviction, while the worst are full of passionate intensity. So time and the cycles of life are no longer as comfortable as they have been, and instead look something more like this, where yes, it's circular. However, the circles are not the same size. They're not the same shape. You look into this, and you can't see the end over there. Or is that the beginning back there? My friends, I would submit to you that this is what we have been living for the last 2 years. We have seen the cycles of our existence, of our jobs, of our lives disrupted. And disrupted to the point where we felt that chaos. We felt that anarchy. We did not feel or know exactly where we belonged or what was going to happen next. Now, in fact, if we take a look back over time, we can see that this has actually been coming at us for some period of time. However, it is just that recently in Louisville, the tectonic plates that held our medical landscape, Norton, Kentucky One, Baptist East, University of Louisville, those tectonic plates, which had been moving ever closer and grinding against each other, suddenly slipped. And with that slippage, what we see and what we have seen is what appears to us to be chaos, maybe even rubble. In the time that I have been a physician, and in the 30 years nearly that I've been here in Louisville, this is, yes, perhaps the most disruptive occurrence, but over time, a lot has changed. Some of you who are my age may remember that for breakfast, lunch, and mid-afternoon, Norton Audubon, Norton Hospital, Jewish Hospital just put out the biggest meals that you've seen in your life. I knew physicians who decided when they were going to go around at Jewish Hospital because this was taco day, or this was pig in a blanket day. I mean, it was amazing. And everybody would gather together in the doctor's lounge and talk and have a meal and be there together. But the fact was that the hospitals were courting the physicians because the physicians were all important. Physicians are still important, but we certainly don't hold the same place in the healthcare system that we did 30 years ago. And in fact, the very definition of what a physician is and what a physician does and the purview of a physician is changing. We now work alongside many providers who have not gone through exactly the same training that we went through, and yet there are many of them performing many of the same jobs that we were trained to perform. In fact, I saw just recently where an advanced practice RN won a case in Florida where he is now allowed to call himself an anesthesiologist. And his argument was, well, I'm an expert in this field. I know how to administer anesthesia. So what does that mean for physicians? Does this mean that Flexner was wrong? Maybe I didn't need to learn to memorize the Krebs cycle. It's not really, necessary. that all of those basic sciences that I had really, don't make that much sense nowadays? Maybe Flexner was wrong. On the other hand, maybe somebody took Flexner's notions that medicine should have a scientific basis and perhaps took it a little bit too far in one direction, and we're now seeing where we have to pull back. But the fact is that a lot in medicine has changed. A lot in academic medical centers has changed. And for us in Louisville, Kentucky, this latest event with the closure of Kentucky One facilities and the acquisition of the Kentucky One assets by the university has been most disruptive to us. So at this crossroads, it is understandable and definitely worthwhile to ask the questions, who am I? What am I? Where am I and where am I going? And I think before I just launch in with the answers to that, it's important then that we take a step back and say, what is the substance and what is the structure? What is it that is at our core that is important? And what of the rest of it, is nothing but stuff to look at? And if we just look back at the history of this medical school, you would see that the structure has changed dramatically, while I would submit to you that the substance of who we are has not. So the medical school here was actually started in 1833. It was considered a medical department of the university, and of course, we all sort of have a notion of what medicine and medical practice was like in the early 1800s. Leeches, bloodletting, snake oil, not a whole lot of real scientific medicine there. During the Civil War, the dean of this medical school was actually imprisoned. I would like to be able to tell you that it was because he was helping runaway slaves get to the north. Unfortunately, it was because he had contracted with the Union Army to supply them with feed and didn't do that. And so he was placed in prison for a couple years. Amazingly enough, after the end of the Civil War, he was reinstated as dean. I guess they didn't consider that very much of a revolution at that point. Throughout the end of the 19th century, the number of medical schools in this city proliferated, and by the turn of the century, there were 6 medical schools. Once the Flexner report came through, these medical schools, within very short order, because it was decided that we needed standards for our medical schools, in very short order, these 6 medical schools were consolidated into one, which is the University of Louisville Medical School. Now, if we thought it was a revolution for Jewish Hospital to be acquired by the University of Louisville, think about what a revolution it must have been for those guys when you had 6 medical schools, you had faculty at all of them, and then all of a sudden somebody says, oh, you're not a medical school anymore. And if you want to continue to practice, you're going to have to do this, that, and the other. So we had a revolution there, definitely. I had the opportunity of going through some of my father's stuff. My father graduated from the University of Louisville Medical School in 1952 and came across his little leather-bound pamphlet that was his little program for his graduation. Yes, it was very pretty. It was actual leather. It was embossed. On the inside of it had the names of all the people who graduated and what they were planning to do. It also had the names of all the faculty. So, little quiz. Does anybody know how many faculty there were in the Department of Medicine in 1952? 8. there were 8 members of the Department of Medicine faculty. 3 OB-GYN, dermatology, Dr. Callan, dermatology was its own department. It was called Department of Dermatology and Syphilology, which just tells you something about the times. There was actually a department of preventive medicine as well. Not sure what happened to that. Nonetheless, you can see that we went from 8 faculty to the huge number of faculty that we have now. Again, a revolution in what an academic medical center is, what an academic medical center does. So the structure of the School of Medicine and the Department of Medicine has changed dramatically over the 200 years that this has been a medical school. And so if we sit down and say, okay, what is substance and what is mere structure? In a nice little piece here from Crosby, Stills, and Nash, to separate the wheat from the chaff. Who are we? And we are who we always were. Community of world-renowned investigators, community of master educators, and a community of top-notch clinicians. That's what we've always been, and that's what we are now. What are we? Again, we are what we always were. The bedrock of the medical community, an integral component of the fabric of the entire community. We are, in fact, in many ways, Louisville, Kentucky itself. The mission that we have to discover, to teach, and to treat is something that no other health system in this city can claim. It makes us special. It makes us unique. Where are we and where are we going? We are on the brink, quite frankly, a revolutionary transformation. We are redefining the medical landscape of Louisville, Kentucky at the same time that we are redefining ourselves, and we're stepping out as the premier healthcare system for the region. So during this period of turbulence, we say, and having the position that I have, and let me just say, by the way, this was not something that I ever aspired to in my entire existence. It's nothing that I ever felt that I was really prepared for, but it forced me to think about leadership and what leadership means and who I found admirable and applicable to this situation. George Washington, austere, maybe a bit reserved, but decisive. Mahendra Gandhi, a transformative individual who fought against the system. And Martin Luther King Jr., visionary and charismatic. And what I like about the leadership of these 3 individuals is that they were willing to step out in front and say, I believe in this cause. They were willing to risk imprisonment, and yes, even their lives for this cause. And it was all about the cause. It was not about them. It was not about power. Now, that being said, I think we would all agree that we really cannot pick up the techniques that these guys used to lead us where we need to go. I'm not going to cross the Delaware. I'm not going to march to the sea to make my own salt. And I'm certainly not going to ask that everybody in this room undergo imprisonment due to civil disobedience. This is not going to be worthwhile. So when I think about you guys, it has been, I've always known that this was a very, very talented collection of individuals with very unique skills. But of course, I've learned that even more. And I will have to say that, one of the most gratifying things of the past year has been to see that despite everything that's been happening, an increasing number of you, I see, are reaching out and saying, I'm going to take charge of my own career. I am going to make sure that what I am doing is important and that I'm going to direct how this medical center goes. And this is what I need. On the other hand, we live in an environment that really rewards individual achievement. Craig McLean doesn't get an NIH award because the NIH says, University of Louisville School of Medicine, these are great guys that collaborate all the time. Let's give Craig McLean a grant. No. They say, Craig McLean, does he have the ideas? Does he have the publications? Has he written a good grant, et cetera, et cetera? The same goes for people who win teaching awards. Same goes for individuals who are told that they are top docs in the city. Individual achievement is valued. And at times, collaborative achievement is not. And yet, on the other hand, to have a successful Department of Medicine, you have to have that collaboration. You can't have a bunch of people who are simply heading after their own little career goals, to hell with everything else that's going on. So I looked to an entirely different group of individuals. I looked to those who lead in the arts. Leonard Bernstein, I think arguably one of the best conductors, composers, and educators in music of the last century. Alvin Ailey and his main ballerina, if you will, Judith Jamison, who also became the head of that dance company. Clint Eastwood, who moved from being an actor in rawhide, B movies, to becoming a director in his own right. All three of these individuals have to take people who are very skilled, very talented, motivated, and driven, get the best out of them, and yet have them all work together towards a single goal to produce a work that is beautiful and is worthwhile looking at. I think of all of the examples, the one I think that fits with what my idea of a department chair should be is the conductor. And the reason is that, so there's Leonard Bernstein right there. He is a small, almost insignificant figure in this entire orchestra. And you can see that orchestra is composed of different sections. Violinists, maybe general internal medicine, percussion, heart, winds in there somewhere, obviously pulmonary, and staff, the people that hold us all together and make things actually work. So the conductor knows what the talents are of each of the individuals and is able to reach out there and say, give me more. But at the same time, pull all of these talents together into a piece of music that is utterly beautiful. So, whether you look at the situation now and you think to yourself, I'm standing on the precipice, or you look at it and you're thinking, we are on the threshold of something fantastic. We probably are, all of us right now, thinking maybe a little bit of both. Either one, we know. We know that these steps forward now are not going to be incredibly straightforward. The maze that this man is stepping into has storm clouds on the horizon. He can't see the end. And I think that's only fair, because I don't have a crystal ball. I don't know what everything is going to look like at the end. I do know that we are going to have roadblocks, blind alleys. Some things we're going to try aren't going to work. Others are going to work magnificently, but I have faith that we are going to reach an end that is satisfactory at the least and magnificent at the best. The last year at this time, I asked that all of you step up and be part of the solution. This year, I am asking you to join me in transforming the University of Louisville School of Medicine, Department of Medicine, into a 21st century enterprise of which we can all be proud. The school, I have to say, of the school emblems, I very much prefer the Minerva profile over the angry cardinal. However, you guys may or may not realize that we are not allowed to use that, unless you're like the president of the university, which I'm not. So, on the other hand, I really like this depiction of Minerva because it reminds me and reminds us that Minerva was not only the goddess of wisdom, was also a warrior. And in the words of the great John Lennon, it's going to be all right. Thank you. That's all, folks. Yes, Peter.
But when you talk about destruction, don't you know that you can count me
Thank you.
out?